Tinnitus is a symptom. It is a symptom which the patient describes to us as doctors, saying that he or she can hear a sound. It can be a low buzzing noise, high hissing noise, but it is a sound that only he or she can hear, that no one else can. It actually comes from this organ. We call it the cochlea. Here, inside this organ, lies many nerves, which pick up the sensations of sound, translate it into nerve impulse energy, which your brain can then translate and understand. Whatever conditions that affect the cochlea, that kill some or all of the nerves, can cause tinnitus. As I've mentioned before, tinnitus arises from this area here, from your cochlea. It is a sound that your brain seems to interpret as a hissing or buzzing noise. What can reduce it? Whenever your brain is irritable or hyperstimulated, the tinnitus may sound louder. For example, when the patient is anxious. So one form of treatment, though not always recommended, are drug treatments that reduce the stress of the patient. Other things that can increase the sound of the tinnitus or the level of the tinnitus are any conditions that can obstruct sound coming in from the outside that would mask the tinnitus and make it louder. For example, the patient may have a large piece of wax in the ear canal. Therefore, sound from outside cannot enter, and the tinnitus inside therefore sounds louder. So we remove the wax. There may be an eardrum perforation that may need to be sealed, or an ear bone may not be working well. Finally, you may have a middle ear infection or middle ear fluid, and the fluid inside here prevents that eardrum from moving, and therefore the tinnitus sounds louder. After discussion with these patients, surgical or medical treatment for any of these conditions can be considered. It is really very difficult to prevent tinnitus or ringing in the ears for a very simple reason. It arises from within. However, certain very simple methods can be employed. Make sure that you have enough sleep. Therefore, your brain is not so sensitive and therefore more able to inhibit the signals that come from this area. The other way as well where tinnitus can be reduced is by distraction therapies. Have you not noticed, if you have tinnitus, that it sounds less during the day and more during the night? The reason for that is because you're distracted by the activities that you undertake during the daytime, as much as the sound from the environment that comes in that masks the sound. And at night, the only way to minimize the tinnitus, though not preventing it, may be to have a little radio by your bedside that gives you a little bit of this environmental sound that helps to mask the tinnitus.